My name is Ashley Klein-Jimenez. I am with PreventConnect and the California Coalition Against Sexual Assault. You're joining us for our web conference today, Let's Connect, Sexual and Intimate Partner Violence Prevention During a Pandemic. PreventConnect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. I need a drink of water after that. So our objective for today is that we're really hoping to have a conversation. What are some of the challenges that you all are experiencing, but also what are some of the opportunities that are really presenting themselves in terms of advancing the prevention work that we're doing, even in a public health crisis? We also want to think about ways that we can stay engaged to communities and see what that looks like, if that's remote or if there's other ways for us to stay engaged, and then discuss some of the implications for community and societal level prevention. Those are our objectives today. And I wanted to just start by saying that while we haven't ever lived through what we are currently living through in terms of a global pandemic, plenty of us have experienced other types of disasters and have had to adjust the way that we think about our prevention work. And so David Lee, my colleague, I know you have a story about this, and I'm wondering if you would share it with our audience today.
Well, thank you so much. And I know we are at 500 people, which is the max on our license. This is by far the largest PreventConnect gathering that we've had. So it speaks to the need for connection. And it's great to see prevention practitioners from all over being able to see doing it. And someone's asking if there's a phone number. And so, yes, there is. Well, it's in your invitation. So in 1989, I was working in San Francisco, California, doing sexual violence prevention work in the schools, and had a wonderful job doing work, actually working everywhere from preschools to training peer educators in high schools to be able to do a wide variety of work. And in the fall in October, we experienced the Loma Prieta earthquake, and you see a picture here. And as a preventionist, when I could finally get back in to go in to the schools, it became the question of what would I do as a sexual violence prevention practitioner. And as I started going into classrooms, I saw there was so much trauma. I saw that there was so much shock that people are in, and that the issues that we had to talk about were not going to be about what was sexual violence, even the strategies that you would take to prevent it, but it was talking about people's experiences and talking about what I did was like to be living through an earthquake. And what it was doing is we were starting to address these issues that were brilliant, is what we were addressing was, what does it mean to be a community together? How does it mean to express our feelings? How are we able to move forward? And in 1989, I was not as trained in public concepts, but I knew intuitively, I think we all know intuitively, and that now our science is showing us that social cohesion is an important protective factor. Social connectedness is an important protective factor towards things such as sexual violence and other issues, domestic violence. And that this conversation that we had was really helpful. It also forged relationships, that we were there to meet the needs that were existing in the community. And the community was not wanting to talk about sexual violence at that time, but they wanted to talk about how we would come together, and we were able to be support for that. And I felt we were able to strengthen our sexual violence prevention message and work together to be able to move forward. And so today, when I look at what's going on, obviously an earthquake is very different than the pandemic we're experiencing. The scale is much broader, the number of people, the length of time. But I think our response as prevention educators is so important. And so I'm really excited. I'm going to have to leave shortly, but I'm so excited that we get to learn from and with each other on what we're going to be able to do. So that was sort of my thoughts about from 1989 and the earthquake of prevention education long ago to what we're going to be doing in 2020 and beyond in this days of pandemic, and how we can be working to create the worlds we want to create, worlds where people are connected, worlds where we have more protective factors to prevent problems, not just sexual violence and domestic violence, but other issues that are facing our communities.
Thank you so much for sharing that story, David. And I saw in the text, Emily said, I love this message. So hopefully it's resonating for all of you folks out there. But I definitely, think that that lesson is really important as we try to move forward and think about our roles as preventionists. And I really want to recognize, and David, you talked about trauma, and I want to recognize that many people are experiencing different triggers and trauma due to what is going on. And although, we're really trying to move ahead and look toward solutions, it's so important for us to acknowledge that we're doing this in a crisis and that the impacts of the crisis are really real in people's lives. So with that in mind, we'd really like to hear from you all and just ask you, what are you doing to take care of yourselves right now? I think that, a lot of us are finding different routines and different strategies. And so we'd love to just have you all share. I know for me, being sure to get outside a couple times a day and breathe in fresh air is really, really important. But I see exercising, lots of baking, breathing exercises and yoga. I see a lot of cooking and being outside, exercising, gardening. Oh my gosh, this text chat is going quick. I saw someone playing the ukulele, hiking, video games, connecting, staying connected with the people that we love. Virtual game nights with friends, reading light, positive novels, sewing, journaling, yard work, praying, aromatherapy. I mean, as different as we are, as different as the ways that we're finding to cope. So thank you all so much for sharing and keep that coming. People are Lego building. That's great. Disc golf. There's so many ideas for ways that folks are finding ways to, take time for themselves and to really nurture self-care. So thank you. Tori, I'd like to pass it over to you and have you introduce our two guests for today.
Happy to do that. Thank you. And thank you everyone for all the great self-care ideas in the text chat. So we are so excited to have our two guests on this web conference today. We have Alejandra Aguilar from the California Partnership to End Domestic Violence. Alejandra does the statewide prevention work for the partnership. So hi, Alejandra. Are you still mute or unmuted and with us? Also, Artie says happy belated birthday, Alejandra.
Thank you so much. So excited to be here with you all. Can't wait to hear what amazing ideas we all come up with together.
Yes, absolutely. And we also have Sarah Orton. Sarah Orton is with us at the California Coalition Against Sexual Assault as a project coordinator. So Sarah, hello, welcome again.
Hello, thanks so much.
Awesome. So we are going to have you all guide us through some of these things of how do we do prevention right now. Before we move into that, we want to go back to our audience quickly. We've talked about what we're doing to take care of ourselves, but we know as preventionists that we also work in our communities too. So, and this is really brought out by something that we've been reading at PreventConnect and with our colleagues with Arlene Vassell recently published a blog on VAWANet with this quote: "This moment in time calls upon us to purposefully restore humanity for all. When we work together, care for ourselves and each other, and stay connected to the core values that guide us, social transformation is possible." So thank you, Arlene, for providing that quote and that in that blog for us. And yes, we want to have social transformation happen. We know that social transformation is possible. And in this moment, we're not just taking care of ourselves, but we're taking care of our communities. So we want to hear from you all in the chat. Before Sarah and Alejandra give us some great ideas of what prevention work looks like right now, what are you all doing to take care of your communities in this moment? It can look different. We know that communities are very different from one to another, and communities are being affected differently. So we want to hear from you. What are you doing to take care of your communities? And Ashley, as folks are replying, I just saw a bunch come in. So I'm starting to see a lot come in about Zoom therapy sessions, keeping in contact with folks, telephone support, checking in on folks, and staying connected. And wow, they're coming in so fast that I can't read them, which is a really great conversation to have. So I think what we'll do is, Ashley, I want to turn it over to you, and we'll give folks a second to keep replying in the text chat. But we had asked you all to give us some ideas before this web conference. So Ashley, can you let us know what those were?
Yeah, thanks, Tori. So we sent out a SurveyMonkey late last week with just a couple questions because we knew that this likely would be a full web conference, and we wanted to be able to hear from you all in a different way. So about 170 people responded to that SurveyMonkey, responding around the current challenges and opportunities you are finding in your prevention work. And not surprising, there were some definite themes that we wanted to share with you all. So first, looking at some of the challenges and what those themes were. Well, many of you who are doing advocacy work shared challenges in being able to support survivors right now, and concern that survivors were being further isolated. We also heard from many of you about some of the obvious challenges that come with having to be physically distant from people, and thus not being able to do particularly in-school programming. A lot of you also talked about how you spent months and months planning these big community in-person events for Sexual Assault Awareness Month that, have now had to be canceled. And we also heard from many of you, and I think, David mentioned this also when David shared about the earthquake back in 1989, but really being aware that the community's focus is not on violence prevention right now. It's on needs that we know are very connected to violence prevention, but it's definitely, people are really focused on other needs. We also heard that while there seems to be a really big push to bring everything online, a lot of you recognize that the work you're doing in communities wouldn't necessarily translate well virtually. So those are some of the big themes that we saw. In terms of opportunities, a lot of folks did share that they were finding new and creative ways to virtually engage their partners in communities, and maybe even, reaching new communities. Many of you shared that you saw an opportunity to launch social media campaigns and to be able to interact with new audiences that way. A lot of you said that you're taking this time to really ground yourself in research, to be able to plan and expand your knowledge around prevention. And some of you are also finding yourselves in new partnerships and collaborations based on the current needs of your communities. And so you're finding opportunities there to connect with folks that you may otherwise have not. And then I think one of the other things that a lot of folks shared is that the pandemic and its outcomes are helping to be able to make connections to systems issues, to health disparities and inequities, and the connections to violence. And so you're using that as an opportunity. So before we move into hearing from our guests and thinking about what it means to do prevention work during this time, I did want to highlight a resource for the folks who are doing primarily advocacy work right now. And this is a resource from the National Sexual Violence Resource Center. They have a list of resources around different topics Some of them are showing up on your screen, and we're going to provide a link in the text chat so folks do have that resource if you're primarily doing advocacy work. So Tori, I'm going to hand it back to you.
Thanks, Ashley, and thanks for providing that resource for folks. So another thing that we had heard from folks in the SurveyMonkey is that when we're thinking about prevention and really what the end goal of prevention is that we are seeking to create thriving communities. And in this moment right now, people have a lot on their minds. So sexual violence prevention, intimate partner violence prevention may not necessarily be at the front of folks' minds. There's some other survival necessities that may be more at the front of people's minds. But in our roles as preventionists, we know and see connections between what's happening in our world with the coronavirus pandemic and what it means for sexual and intimate partner violence prevention. And I am so excited that we have two wonderful prevention specialists on the phone with us, with Alejandra and Sarah, to be able to share more about, what does it mean to be a preventionist right now? So Sarah and Alejandra, I am going to let you both take it away from here and tell us about, what does it mean to be a preventionist?
Thanks, Tori. I'll go ahead and get us started. I think as new social norms emerge, it's really essential to leverage a critical eye towards preventing violence, especially. We know that public health models that discuss creating protective environments and eliminating risk factors is a really important area, and especially as those things really intersect with the root causes of violence, such as oppression and inequity. Also, social and structural inequalities are being highlighted now more than ever as new trends and things start to emerge. And I also want to say that there's really an opportunity in addressing these as they're kind of glaring right in front of us at this moment. So I think one thing is that it's important to start asking ourselves, especially hard questions about accessibility, as these dichotomies start to become more apparent. So for example, how do we make interacting online normal and accessible for those, particularly those who are marginalized? What norms do we perpetuate that center white idealized concepts of professionalism? What aid are we providing to the community in return for them showing up to our cause, right? We know that we still have participation in our prevention groups, that we still have clients needing our services. And if those folks weren't showing up for us, that would be, that would be a detriment to our livelihood. So, starting to really think through, is there showing up for us in those ways? What ways do we have at our disposal to show up for them? Also bringing us back to grassroots organizing and how our movement started in the early 70s, even before government funders and Zoom meetings and school-based programming. Our field was built on grassroots feminist organizing. And, while public health, which we'll be talking about as well on this web conference, certainly offered assets and some really helpful framing tools, it's ultimately not what shaped the social justice aspects of our movement. And I saw some of this come up in the text chat. I've heard this come up in our California RPE groups. It may feel that right now our prevention work is less essential as focus shifts to crisis response and direct service needs. But our role as preventionists in the long run, or in the scheme of things, is really to help people make those connections and to see the bigger picture. So now more than ever, it's really time, I think, to shift our focus away from, obsessively trying to meet grant deliverables and center ourselves in the heart of what this work is really about. To give a couple of examples, and I see RPE folks on this call, so hello to you all. We have seen some of our RPE programs in California do some really innovative things just in the last couple of weeks. So for example, a lot of programs are engaging groups in media literacy and critical movie reviews using the Netflix app, which is so important right now, right? As we know that people are spending so much time, so much more time at home in front of the TV. Others are sharing links to social justice oriented films and even a film festival and hosting debriefing sessions about that on Zoom. We can do other low tech things like engage the community in mutual aid sexual assault awareness projects, like making and donating teal masks to your local Planned Parenthood for SAM. And I think contrary to maybe some of the popular belief, now is actually a really great time. And Alejandra will be sharing a little bit about this later, but it's a really great time to reach out to potential community partners by just shooting over an email and saying, hey, what can I do? How can I help, with no strings attached, without, really centering, wanting, to get something out of that interaction, but just, showing up for other businesses and organizations and social service agencies and saying, hey, can I do?
Absolutely. I think for me, the key role of the preventionist is there's a colleague of mine, Miranda at the partnership, and we joke about being chameleons. How many of us as preventionists have showed up into spaces where we're told that we're going to have a classroom full of, 30 youth. And guess what? There's been a challenge and you have 5. And you had these activities planned that you were going to develop. And now you're not going to be able to carry them out because you only have 5 folks in there. Or you were supposed to have a room full of parents and only 2 showed up. As preventionists, we adapt to challenges. We thrive when things are not the way we're supposed to respond. So for me, this is a time to remind ourselves about these skills that we have, about these strengths as prevention chameleons, and to be tolerant of ambiguity. There is so much ambiguity all around us right now, and it's important for us to show up in this way. Prevention unicorns. We're the only ones that do what we do in the agencies. Absolutely. So let's remind ourselves of this and let's lean into those strengths. Prevention started, as Sarah is mentioning, from feminist organizing in response to crises, in response to problems that were showing up in the community. And they didn't show up with solutions. They leaned into the community to find solutions that would be responsive of those needs the community was facing. So we want to engage in this conversation with you all to identify ways in which we can all be amazing prevention chameleons and unicorns that lean into the community. Next slide, please. It is a perfect time for us to remind ourselves of where this all started. Late 70s, early 80s, we started looking at some of the problems that were causing deaths in our communities, the problems that were causing major diseases and illnesses in our communities, and be able to do something about it, right? So the public health model was developed. And we all know, we know the moving upstream approach that we speak about as preventionists. And this is now more than ever the time for us to remind ourselves about those fundamental principles of our work. It is about making sure that we are showing up for the community where they need us, when they need us, and where they are at. It's time to maybe take a step back and push your scope of work aside. Now, we might have some funders on this call to get upset with me saying this, but it is time for us we have all these scopes of work and the theories that we had in mind and a strategic plan with deliverables and milestones. And that's not going to be possible right now because of everything going on. But we can define new ones. We can create new strategies that adapt to the current status of our communities. So just a reminder of where this is all coming from and the skills that we have, right? So define the current problem. If you're going to be working, you had a plan to be working with schools and educating teachers and working with students on creating a safer school environment, you can still work on creating a safer environment. But think about where are the youth at? So the youth are at home, right? Defining the problem. If there are problematic situations occurring in a home, who can you reach? Identifying your risk and protective factors. What are you going to be able to focus on? And developing some new strategies that respond to those needs. I've been talking to preventionists across the state, and yes, we may have started January with the plan to implement coaching boys into men with the athletes, or shifting boundaries across the entire school district. And now we don't have access to that. Okay, let's let go of that box and let's think about new strategies. So where are the youth? They're at home. Who do we have access to? Do we have access to the teachers? Don't forget about the seeds that you have planted throughout your past several months or years working with these partners. Who is your champion in that school? Can you reach out to them? Can you find ways to maybe send some resources home, to talk to the teachers about sending positive messages to the youth during their online school platform? Maybe resources and messages that help uplift the youth and remind them that as a trusted adult, you may not be there physically, but you're there and you're there to respond to them. It's about thinking about new strategies that help us respond upstream. I love saying this, and it's a great reminder for all of us that the bystander strategies, right, now more than ever, doing nothing is not an option. When there is a crisis, we show up and we are present and we hold each other's hands and we walk through this together. So let's find some ways through this conversation to do that together. Next slide, please.
Thank you, Alejandra. I feel like I should have turned my camera back on at some point when you both were talking, because I was head nodding so much throughout all of that for both of you. Thank you. That is so important to be grounded in that work. So before we move on and talk about, some of these connections that we all are seeing and how that plays into our prevention work, we want to know from you all, what challenges do you see in continuing prevention efforts in your communities? And so feel free to type that in the text chat. Lindy just replied with people with no access to virtual options, collaboration, one agency cannot do it all, student staff burnout. Great, thank you. So we will move forward and hear from Sarah and Alejandra about needs and where do we go from here?
Tori, before we do that, can I just interject real quick? Okay, so I just wanted to say thank you so much, Alejandra and Sarah. A lot of what you just talked about, I feel like was coming across not only in the text chat right now today, but also in some of what we heard on the surveys. And so this idea of needing to be adaptable and to really tune into what the current needs are in communities is so huge right now. So I just want to, thank you for sharing that. And I think that people are seeing the importance of using this time to take a pause and really look at how programs are or are not community specific, community driven, community responsive, and within a community context, right? I think that Beth in the text chat talked about being kind can be part of being an active bystander, which is an approach to stopping sexual violence. And it's also an important piece of showing care and connection in our communities. So there are so many parallels right now that we're seeing. And, I think it's perhaps this time is a time to allow folks to really redefine their work and to be able to expand their focus to strategies that can support people across the social determinants of health, all of which are being heavily negatively impacted by COVID-19, right? So I know that Sarah and Alejandra, you've been talking to people across California and beyond. And so I'm excited to hear about some of the needs that you're hearing from. So I'm going to pass it back to you.
Thanks, Ashley. Thanks for framing all of that too. So what are the needs? I'm like a bullet point kind of a human. So there were just a couple of things as we were prepping for this web conference that came up for me that I wanted to highlight, just sort of based on what I've seen going on in California and what we know about times of crisis in general. I think that we're seeing that folks need resources that are accessible and community specific. We know that resource lists, and my colleagues have heard me say this 1,000 times this week already, but resource lists are being distributed in abundance, but pages and pages of text and hyperlinks can be really overwhelming. So I would urge folks or invite them to, before distributing resource lists, try to imagine who your audience is, right? And if possible, discern how your audience likes to receive and process information. So what platform, email versus phone, or a no or low tech option, links to websites versus, things explained out or videos or podcasts, and really trying to imagine and circumvent barriers whenever possible. And also this brings us back to kind of like the basic tenets of sexual assault victim advocacy, right? Which is don't ever assume that you know what the need is. Remain curious and keep asking. I think that folks also need providers, whether this is prevention work or direct service work. People need providers to be innovative, to think outside the box, to, like I said before, really ground themselves in the heart of what this work really is, and be present and sort of mirror a sense of calm. I know I don't want to, devalue in any way the fact that like we're all going through our own stuff. Personally, we're in a traumatic time, as Ashley named earlier, but even still, when we're able to, mirroring a sense of calm. I think what I've noticed that we need as prevention practitioners is for our funders to be present and communicative. While I said earlier that grant deliverables shouldn't necessarily be our primary focus right now, there are so many staff at RCCs who are still concerned about their livelihoods too, right? Or might be the only person still generating income in a household. And there's a lot of opportunity for our funders, I think, to have a big role in really clearly communicating their expectations and providing that reassurance where appropriate. So if there's any funders on the call. Of course, patient empathy and understanding are really important right now too. Creating safety and community, which we know is a huge component of creating protective environments, has everything to do with fostering a sense of understanding and encouraging people to really have empathy for their neighbors, encouraging nonviolent communication rather than calling or involving law enforcement when that might not be necessary, and really starting to think through transformative justice principles of accountability as a strategy for community safety.
Thank you, Sarah. I'm sitting here reading the chat as well and figuring out like where do we go from here, right? So I am inviting myself to let go of a plan, right? I had a plan I have these projects that we are leading across California, and there were plans and milestones and deadlines. And it's very hard for a lot of us to let go of this. I've also heard from preventionists across the state that are feeling almost a grief and loss from losing access to their events that they have planned for SAM, for example, or events that they had planned for the month of May to be able to lead you through some activities that are going to go on over the summer. And it's hard because we put our life, most of us, right? We put our life into this work. And it's hard to say, that's canceled. Let's adjust and almost like the GPS, right? Recalculating routes. And that is what we are all doing. We are recalculating our route right now. And that can be hard. So it's also a reminder for us to take care of ourselves as preventionists, because that recalculating part can be connected to some grief and some loss, especially if we've put in so much time and energy into this. So take care of you first. And where do we go from here? it depends on the flexibility that you have from your funders. And I love that Sarah brought this up, because if your funders have not connected with you, this is an invitation for you to reach out to them and let them know that you are going to have to adjust and adapt your plans in order to be responsive of the community, right? We've got the language. Be community responsive. Lean into the needs of the community. Where are they at? What is currently going on? So one of the things I'm hearing a lot also about the resources, there's too much information out there. Where can you hone in on sharing information in a way that is manageable and accessible to folks? So there are, I'm hearing from groups that are working off of the local Facebook page. If you are in a rural setting, most often there's a Facebook page for the community. There's a Facebook page for the city, the town, the neighborhood. Connect with the local Facebook page and focus on messaging the impact and the core concepts of prevention, right? I'm just sitting here thinking, if I had, so I'm Mexican, and I grew up in a home where it was my mother, my father, my 3 siblings, my grandmother, my aunt and uncle, and their 2 kids that lived in our home. Trailer home, no computer, no desk. We did our homework in our bedrooms on our bed. So if you are living in that type of setting and you are needing to manage life, that's going to increase everybody's stress, the kids, the parents, the family, everyone. So where do we go? We share some strategies for managing or reducing stress. So these are the spaces in which we're inviting all of us to think about risk reduction. What does that look like? Where do we go? What are some of the partners that we can collaborate with to engage in some of these efforts? Let me see what's going on. So reaching out to the community via Facebook, yes. Engage with partners if you haven't done that yet. The organizing of the resources. So the partnership has started organizing the list of links by category. So a category for housing, a category for survivors, parents with children, teens. The other thing that's happening also right now, imagine yourself being a teen and you were about to graduate this year. You were a senior in high school. And you don't get to see your friends now. You might not be able to walk across that stage. The increase of stress that is going on with you. So let's think about that and how we can make some adaptations in our work. Yes, resource booklet that goes into the food bank bag so that people have access to information, including some self-care. Absolutely. Post office is a great space. So think about the areas where people are still at. I know I saw a comment on there that the organizations that we work with are shut down. I would invite us all to reframe that. The organizations are working differently. Schools are not shut down. The buildings might be closed, but the setting itself, the structure, the system is still working. The colleges and universities are having to work differently. Restaurants are shut down, but there are people that are also still working behind the scenes for pickups, right? So that is happening. Schools are also opening during the school lunch hours to be able to drop off or pick up lunches for kids. So let's reframe. Organizations are not always shut down. They're working differently. So where do we go? And where are the businesses that are booming right now, that are just overloaded with customers, and let's try and partner with them. So I'll come back to that in a little bit.
Thank you both so much.
Thank you. Sorry, Tori.
No, you go ahead.
Gosh, I'm feeling very energized. I had Zoom exhaustion, and now listening, reading the conversations happening in the text chat, listening to Alejandra and Sarah, I'm feeling energized. Thank you. Thank you for this conversation. You know, as much as we knew that the field needed this, apparently I really needed this too. So thank you. So Tori, can we go to the next slide? Because I know that we want to turn back, and I mean, people are freely engaging in the text chat already, but is there things that you haven't shared about how you're continuing or adapting your prevention work right now? This is a great time to share some of that with your colleagues. We'd love to know. I see there's something about toilet paper in here. We can't get away from it.
So let me share, Ashley. Sarah and I were talking a little bit about how we've also had to adapt some of our work. So we have a project in California looking at strengthening paid family leave across our state, increasing access to and awareness of, especially with immigrants and low-wage workers. The plan was for us to, and please keep typing while I'm sharing this, think about how you are continuing or adapting your prevention efforts. The plan was to develop or implement regional trainings across our state in English and Spanish that help folks understand about paid family leave, how to access it, how to apply, and then be able to use a paid family leave training toolkit that we've developed to then go out and train and teach others. So we can't do that anymore, right? We can't have our regional trainings. So we are going to have to go online. Well, that has brought up the barriers that several of you have talked about. Not everybody has unlimited data. Not everybody has access to a laptop or a computer that they can do Zoom from and be able to access and download all of the links. So in addition to that, we have decided that it makes sense to also do town hall forums where people can call in and ask questions. How do I file for unemployment is the number one question that keeps coming up. So guess what? We have decided to expand our list of services or benefits that we're focusing on. So not just paid family leave, but also unemployment, clarifying information for immigrants, because unfortunately not all immigrants understand that unemployment comes from federal funds. So undocumented immigrants can't access that. So we're also reaching out to Univision and Telemundo and all of the TV stations that produce in Spanish to be able to get the information out in a way that is accessible. I will say that in the moment it was a mistake, and now I'm so glad I made that mistake. I stated my name, the organization I work at, and provided my phone number, my Zoom phone number. And in one day, we got over 250 calls from folks who were struggling with, how am I going to pay my rent? I have children in school. I need to pay for their lunch. And all of these stressors kept coming up. Now we have 250 folks that are signed up, ready to go for a Spanish town hall forum where they can ask their questions about being an undocumented worker in California and accessing benefits. So we adjust, we adapt, we respond, we show up to people in a way that is responsive to their challenges and their needs. We're going to host these town hall forums on weekends, evenings, at times that people can call in, and we're going to have to explain things. So we're working with our trainers. You're going to have to explain how the employment development website works in a very simplified way, because people are not going to be able to see the website. So it's adjusting, it's adapting, and it's responding to needs. So what came up, Ashley?
So the conversation is just so great, but people are talking about, so there's some questions. So if folks have any ideas on, a lot of people are talking about using social media, but if you don't have a large social media following or a large email base, how do you reach out to people? Maybe this is the time to try to grow your social media following. But maybe folks have some better ideas that they'd be willing to share. Folks are looking to expand their work. So instead of maybe just working with students, now this is the perfect opportunity to work with parents if that's something that you hadn't already been doing. Folks are developing videos that can be shared. There was something really cool that I just lost, so I will find it and come back to it. Coping skill boxes. I'm trying to find where that originated because it sounds really cool. And folks are putting some tips for maybe growing social media by looking for groups on Facebook and being able to get involved that way.
Alejandra, there are a couple folks in the text chat too that are wondering if you can share how they can connect folks to the town halls.
Yeah, currently the town hall is focused on California benefits and accessing those benefits through the EDD page. We are sharing all of our town hall information through, like I shared, Univision. So this is where I remember the seeds you planted. So we were working with Univision last year to talk about financial stress and the impact that it has on our health. And now we have this great relationship with Univision, and we are meeting on a regular basis to talk about the impact that COVID has on survivors and in terms of prevention. So Univision shares that every week with the town hall. We also have our partners. So the California Work and Family Coalition has a network of over 50 organizations that are sharing the town hall. We have it on our website. I'll share the link. On social media everywhere, Facebook, Instagram, Twitter, and your partners are key here. So we have reached out to immigration and undocumented legal centers that support advocacy and prevention work. We're also partnering with, there's Parent Voices of California, that's a parent connected network. We also had someone reach out to us yesterday through Instagram. My Instagram messages are like where I connect with people, and it's so beautiful to be able to use that. So connecting with End Poverty in California, they are also looking at the fact that undocumented families don't have access to the benefits that the rest of us do. So working together, and that is why we're posting, we're sharing, we're explaining things in a much more accessible way through all of our platforms.
Thank you. I hope that folks who have further questions will message you privately about how to get that information out. But I think it's so great that, you talked us through that process. You went back to what are the seeds that we planted? Who do we know that we can reach out to, and how do we reach out to them too? So I think that's really, really a great skill and great advice and guidance for you to impart on others. And Alejandra, I see that you put your email address in the text chat. So folks can reach out if they have more questions about that. So we are going to keep moving forward. We want to bring up this quote from the Prevention Institute. And, one of the first things, and this is before the lockdown started happening in California, one of the first things that I read that really made a solid connection between the coronavirus pandemic and sexual and intimate partner violence prevention was from Prevention Institute, and talking about those system weaknesses. So the Prevention Institute strategic framework says everyone's health, safety, and well-being are dependent on the health, safety, and well-being of others. When we protect those who are most vulnerable, we protect our society as a whole. And I think that's so important to keep in mind right now, because, I'm sure we have all heard this, and I just want to go ahead and give folks permission to feel otherwise. But as with any health issue or any, as with any health issue or pandemic, this is not a great equalizer. We are seeing the same health disparities. We're seeing the same determinants of health that keep folks from having health equity. We're seeing those come up here too. And we're seeing them come up in more dramatic ways than we do in daily life. Everything is elevated. And so we're seeing a lot more of those inequities blatantly as well. So I would encourage folks to view this not as the great equalizer, but as something that is pointing out those system gaps. So we do want to talk more about the gaps in systems that we're seeing from coronavirus that also impact sexual and intimate partner violence prevention. So Alejandra and Sarah, can you walk us through some of these system connections?
Yeah, let me make sure I'm, yep. Okay, so going back to reminding us about the intersectionality of our work, the societal level prevention strategies that are impacting current COVID-19 pandemic or that are being impacted by it. We have economic and food security, access to health care, safe and stable housing, access to paid leave and sick time. These are being impacted by everything that is going on. And there's so many others that, we were not able to add on this slide. And as a preventionist, right, if we're swimming upstream, what is the first thing we're going to notice? Yeah, there's so many folks that are left out. There's so many folks that are there, as Sarah had mentioned earlier, that don't have access to the benefits and the resources that are available. The marginalized groups that we tend to focus on, right, as preventionists, being culturally and community centered. So I'm going to hand it over to Sarah, who's going to walk us through some of these items.
Thanks. So, yeah, I mean, just to go back to the previous point earlier, is that right now more than ever, it's really important for us to consider the intersectionality of all of these social justice issues that I think are sometimes, present, but put on the back burner during our prevention work, and to call attention to some folks or some populations who might not be up here, right? Because we can only fit so much representation on a slide, unfortunately. But I would encourage, folks to ask themselves, what is it like to be a pregnant person right now, for example, right, who needs access to abortion? And if folks haven't done this already, and kind of, talking about that relationship and coalition building, right now might be a really great time to reach out to your local Planned Parenthood or your local reproductive health center and offer support and resources for those who might be impacted by, by reproductive abuse, right? And being curious and investigating kind of what all of that is looking like right now. And especially as these things, and to even use the example again of reproductive abuse, what do those things look like as they intersect with domestic and sexual violence, and how do those two things kind of conflate and bolster each other. I think also it's important to name, even though I don't necessarily have like a ton of research or resources around this concept, but the way that our society has decided to interpret essential and non-essential work has an impact on people. And it's going to continue to have an impact long after this is all over, right? So I think it's important to start thinking about getting in front of this issue and considering and asking ourselves what new social norms might come out of this dichotomy and all of these dichotomies that could contribute to violence occurring in the future. Harmful norms emerge every time we start to assign value to positionality, right? So again, I don't have, a ton of resources necessarily to offer here, but I think that there is opportunity, and the way that we really start to think about right now who is deemed essential and inessential in our society, and what long-term consequences that might have for violence.
So along those lines, also, we're thinking about the folks that don't have access to the essential needs, right? So an item that has come up is elderly people with disabilities who are unable to go out of their homes to buy groceries. You have to be at the grocery store now at 7 a.m. to be able to get access to toilet paper. How can we organize to be able to to get them what they need. We have seen the memes and the GIFs on everywhere laughing about how, someone will take toilet paper from the elderly, and there's jokes about this, how to challenge that and how to maybe organize to ensure that our neighbors are getting access to what they need. So we'll be able to share also, I know it's in the chat somewhere, but the kindness, the invitation to compassion and kindness during COVID-19 is a great reminder for all of us and how we can help these individuals. Also, when it comes to accessing healthcare, so there have been questions from several of you in the chat of why are Black folks separated out? Black folks are at a greater risk for illnesses, diseases, hypertension, stress increases hypertension, diabetes is an increase for COVID-19 or is a risk factor for COVID-19. So these are items for us to be thoughtful about. Right. So thinking about how can we get information home to the parents? How can we get information home to young adults or adults that are in college and university? Where else can we get information out there? So for me, when I was asking you about what are some of the spaces that are very much booming right now, grocery stores. When was the last time that you worked with a grocery store, that you connected with the local store manager? Is there time for us to be able to connect some information or share some information, some resources with them that they might be able to share on I can't remember what it's called, but when you're checking out, there's that desk area or that little shelf where we used to sign our checks off on. And now there's the pad for the ATM or your card. Just like when we go to the doctor and there's that piece of paper or poster somewhere that says, do you feel safe in your relationship? We can now add something similar to the grocery stores. Do you feel safe in your home? Making sure that phone numbers are listed on those desktop areas or those areas, those shelves at the grocery stores. I'm also hearing from grocery store managers that are seeing the levels of stress on folks or people not having access to funds to be able to pay for the food they need. So being able to connect to grocery stores, sharing about where to access paid family leave, where to access sick leave, how to apply for unemployment. So getting this information out to grocery stores. We also still need to put gas in our vehicles. So gas stations are another place that folks can partner with. I'm thinking about where's the other area? Senior facilities and long-term care facilities. There's also access to caregivers where caregivers are coming to the door to be able to visit with their loved ones. So thinking about the different spaces that folks are in and be able to reach out to them about these benefits. And there's also legislative advocacy. In California, there are groups of folks and legislators that are advocating for California to have a separate fund for unemployment for undocumented workers. I just want to keep reminding all of us that the fruit we eat, the vegetables we are enjoying every single day are most often being picked by undocumented workers that don't have access to healthcare, that don't have access to paid family leave, that don't have access to unemployment. Most of them are working in unsafe spaces. They don't have access to a clean restroom. They're out there working. So when we say essential workers, we're most often talking about white, cisgender essential workers. Next slide, please.
Thank you all. Sorry, it's Ashley. I wanted to also just touch on some of the responses that we saw in the Survey Monkey that we sent out, because we did have folks who pointed to how the design of capitalism contributes to violence and is exacerbating the current health crisis. The pandemic, I think, worth noting, is also having a gendered impact. And so we think about like the closures of schools and the fact that women often provide much of the informal care within families means that they're now facing consequences around limiting their ability to work and access economic opportunities. which we know those are strategies for preventing violence. And then we know that women and female identified folks are also often on the front line of healthcare work and overrepresented in the restaurant and service industries. So there's some impacts there. Tori, are there other reflections that you have based on what we heard from people?
I think just another one, and Alejandra said it really, really well, is, when we're looking at who is left out, when we're talking about who's essential, in the dominant narrative, there's, folks are framing it around, white, cisgender, essential workers. But I do want to challenge folks when we're thinking about things like the stimulus check, who is being left out of that and how are the economic impacts different? $1,200 to one person is very different place to place, family to family, person to person. And I know that we also had someone bring up, while we're talking about economic impact, bring up on the SurveyMonkey that before coronavirus, the design of a capitalist system contributes to violence, and responding through a similar framework leaves a significant amount of people without assistance. So thank you for the person who brought that up. We also see that this virus is really highlighting a lot of systemic injustices. That was a huge theme that we saw come out of the SurveyMonkey from you all, and folks are examining how prevention can impact them too. So a few of the important prevention takeaways were, now more than ever, we need to focus on eliminating contributing factors to violence. And there is an opportunity not only to remain focused on who is marginalized and how do we bring folks to center, but there's also an opportunity to focus on connectedness in ways that maybe we weren't used to before. So with all of that, we want to know from you all, how can you deepen your commitment and efforts to addressing root causes of violence and systems of oppression in your prevention work? Thinking about, and Mary also brought up that folks who are sex workers are also being left out. Thank you for bringing that into the conversation. So how can we continue to deepen our commitment, our efforts, our conversations around these when we have so many examples of how this intersects with our prevention work? So I encourage you all to answer this question in the text chat. And as you all are answering, we'll come back and recap these later. But Ashley, I am wondering, what can we do? What can we do now? As folks are thinking about that too. And so Ashley's going to explain this really quickly. And I think Alejandra has a note on here too.
Great. Thanks, Tori. That's really a big question, is what are some of the solutions? What can we do right now? And so I don't have the answer, but what I can say is that we are going to share, I'll put in the chat, a link to a working paper that highlights the links between pandemics and violence against women and children specifically. And what the paper highlights are these 9 pathways that are on this PowerPoint slide. And what I see from that is that many of the negative outcomes of the pandemic are also risk factors for sexual and intimate partner violence. And so, where are the opportunities for us as prevention practitioners then? We also know that many people are talking about how important connectedness is currently while we're being physically distanced from one another. And we know that and David pointed to this earlier, that social connectedness and community cohesion can be protective factors for violence. So as preventionists, we really can't underscore the necessity of connectedness right now. There was an example from someone who completed our survey last week that mentioned they were aware of neighbors checking in with each other via Zoom or other forms of technology to be able to try and protect against increases in home-based violence. I think that resilience is also another area of opportunity. But Sarah, Alejandra, Victoria, I want to throw it back to you all and see if you've seen any kind of community connectedness, maybe in your own communities. Anyone?
This is Ale. Yeah.
No.
This is Alejandra. I think from my end, if you go back one slide, working with children, we've seen school counselors that are reaching out saying that they're very concerned about children who are in unsafe homes, and recognizing that now is not the best time to file a report. So how can we work with children? So school counselors, teachers working together to reach out to children. Plan FaceTime once a week with the youth to be able to check in and how's it going and how are you doing? And asking the specific question. I know that it's really tough right now and that, school is looking different. How are you feeling with all of it, right? How are you managing your stress? Or my niece was telling me that her teacher asked them on a scale of 1 to 10, how stressed are you today? And working with them individually on some grounding techniques, right? And I'm also thinking about other words we can call it, right? So stress management techniques, calming down techniques, because I did hear my niece say, I'm not grounded. My teacher was saying that I have to practice grounding techniques. So maybe use a different word for it. So calming techniques, relaxing techniques, whatever it is that we're going to be working with. But I love seeing some of this work because we are seeing an increase in abuse with children and women. It is Child Abuse Prevention Month. There are a lot of organizations, networks, coalitions across our states that are focusing on doing some prevention work around this. Partner up, reach out. This is a perfect time to do some cold calling and cold emails and introducing yourself and saying, I'm here too. What can we do together?
Thank you, Alejandra. That is so much great information. And the I'm not grounded really made me giggle. Yeah, I think now it's always important for us to be, using the same language as the folks that we are talking to, especially when talking with youth. And that's just another great example. And thank you for bringing up the connections with Sexual Assault Awareness Month and Child Abuse Prevention Month, and how folks can be reaching out to, or how engaged adults can be reaching out to youth in their communities. Ashley, I know for the social connectedness, I've seen a lot of the, similar things with mutual aid organizing groups on Facebook. Been invited to some from areas where I used to live because I have more social media friends there. I've also seen things like people are saying they have a red card, yellow card, green card system with their neighbors in their windows. So if neighbors who are at risk for having complications with coronavirus or unable to help themselves in case of an emergency, are having any issues in their home that require an emergency, they put up a red card. They put up a yellow card if they need groceries or a pharmacy trip and they need somebody to help them out with that. So their neighbors are then alerted, like, so-and-so at number 62 apartment has a yellow card up. So I'm going to go over and or email them and see, what groceries they need, or all's good, green card goes up in the window. So a stoplight system as far as do folks need help and how? Sarah, did you have an example of social cohesion and community connectedness?
Yeah, I think something that I've seen a lot in my community are people using the Nextdoor app, and there are folks who aren't necessarily part of vulnerable populations as far as coronavirus is concerned, and, are offering to do grocery shopping for folks. So there's been a lot of that going on, people offering to run errands and things like that. Something that we've been trying to work on as well, as kind of a preliminary project, is starting a lot of vegetable seeds and getting starts going, and somehow getting to them to those folks in the city, and doing some workshops around growing food and starting vegetable gardens and things like that, which can be really helpful in times like these when people have impacted income and food accessibility and all of that.
Thank you. Thank you both for sharing those additional examples with us. And I know we had asked you all, or both of you, for a couple of examples of where do we go from here. So, and Alejandra, you had mentioned this earlier. Is there anything that you want to add here about engaging adults to prevent violence in the home?
I'm muted. Am I muted?
You're not. That was my bad. I meant to click on my own.
Okay.
Right under me.
Got it. Thanks. This is just a kind reminder. Prevention Institute has an array of resources for collaborative partnerships. If you have not checked them out, please check them out. I love the spectrum of prevention because it reminds us that there are several different spaces through which we can insert ourselves at. So if it's policy and legislation, there's a lot going on right now. I keep saying there's nothing like a crisis to highlight the inequities that are present in so many of our systems. So this is the time for us to become engaged in some policy and legislative advocacy, organizational practices, coalitions and networks, educating providers. It's also an invitation to expand what we mean by providers. These are school counselors, teachers, school administrators, if we're talking about a school. There's also superintendents that are needing to meet on a regular basis to think about how they're going to support school staff to be able to implement some of the work if they are going to. Messages that teachers can send. The websites to the schools are still open, so partnering with these providers to be able to educate and share some messages that are about risk reduction, stress management, conflict resolution. What do you do when you are stressed out as a parent? What are some ways in which you can also manage your stress? Community education. We talked about gas stations. We talked about grocery stores. Who else can you partner with? There's law enforcement. There are firefighters, first responders, where, thinking about who else is present that you see that you can work with. And again, for me, this is a reminder that we need to work across all levels of prevention: individual, relationship, community, and society. Everyone is going to be touched at a different place. So it's a great opportunity for us to work with different partners in our community, from children to adults. There are questions being asked about, yes, and how do we work with schools when they are closed? So again, teachers are needing to send, if the school has decided to do the online education platform, there are packets that are being sent home, or parents have to pick up on a weekly or biweekly or monthly basis. So are you able to share some handouts that you can insert into those packets? If items are being emailed, can you develop a handout that can be emailed out to the students and the parents? Posters that maybe the family can put around the home. I've been seeing on Instagram and Facebook that parents are putting up messages across their home. So some positive messages that you can share there. Also, maybe some reading materials, right? So what are some positive books, positive media that youth can watch with their parents, or that parents can watch, that they can have some conversations with each other? There's nothing like being at home with one another to have conversations about healthy relationships and the prevention of sexual violence. What does consent look like at home? How can you set up boundaries when you are at home with, 4, 5, 8 other people. And then just an invitation again for building relationships and coalitions. I love this graphic again from Prevention Institute that reminds us that there is always another partner that we can engage with. So for Sam, there's some great ideas. Sarah was sharing some amazing ideas with me this morning, and it got me thinking about what do we do? So we are hearing from folks across the state that, again, they are grieving that they're not going to be able to engage in all of these amazing SAM activities that they have planned for April. So what do you do? What do you do with all those behavior modification materials that you ordered to use in April? What do we do with them, Sarah?
Well, certainly not on the spot at all here. So, I had mentioned the idea about doing something low tech for the community, like creating teal masks for Sam, taking them to grocery stores, taking them to your local Planned Parenthood or hospital, nursing home, right? Each community is going to be different in regards to where the need is. But take your Sam materials there too. Drive around town, drop them off as you're kind of like hitting the pavement and building connections at grocery stores and gas stations or with healthcare workers. You can certainly bring those materials and give them as sort of an offering to folks. If you have posters or placards or, whatever, ask folks to put them up in the window. There's certainly a lot of options for disseminating that stuff. And then whatever you don't have or you can't get rid of this year, you always have it for next year, which is great. Okay, make a plan and show connections. We are like so close to out of time, but I do really want to highlight a couple quick things, but I apologize. I'm just going to sort of like breeze through, but hopefully it's still a little bit helpful. We did want to talk a little bit about, kind of going back to what I mentioned earlier about funders. And I know just from, our folks in California, from the RCCs, there's a lot of concern around funding and meeting grant deliverables. And so just a few suggestions, we would recommend proactively reaching out to your funder with a plan rather than asking for guidance. If they're not being super responsive, provide an outline of what you intend to do and how you're addressing the impacts of COVID-19 through and with your program. If plans need to change, show funders and in some cases supervisors exactly how and why they have to change. So, be solution oriented, right? So offer a solution after stating the problem. Here's what we can't do, but here's what we can do. And some funders and even nonprofit leadership might need help in making connections between sexual violence prevention work and all of the equity and mutual aid work that we've been talking about on this call. So feel empowered to be the expert there because you are, and help those folks see the bigger picture. And, for those of you in California, you can certainly reach out to both CalCASA and the Partnership for Training and Technical Assistance around this. For those of you in other states, I'm sure that you can reach out to your state coalition for training and technical assistance as well. And then, lastly, we would recommend find creative ways to measure your efficacy because evaluation is going to look really different, right? Qualitative data is your friend right now. And so is capturing the stories of what is actually happening. And so even collect data, even if you might never use it, even if you might know, I know some data folks would keel over if they heard me say that, because people don't like collecting useless data. But you understand the point. Be gathering those stories, and you might be able to spin it later into something really awesome for evaluation. And lastly, we'd really invite folks to lean heavy on peer networks. Everyone showing up to this call today or this web conference is already doing that, and we've seen a lot of turnouts to our peer network calls as well. But, aside from PreventConnect or coalitions, exchange emails, reach out to each other, see what other folks are doing and what's worked.
Thank you both so much. I really appreciated hearing from both of you. Alejandra, your inspiration about building relationships. I know folks have told us in the SurveyMonkey that they're noticing that not just within sexual violence and intimate partner violence prevention field, but other social services and support organizations are activated as well. So folks are really engaged and ready for partnerships or for conversations about partnerships and how that would happen. And yes, Sarah, being able to make an adaptive prevention plan, that is so important for folks, and being able to capture everything that's going on right now and seeing how that impacts our work. So we only have a couple minutes left. I know Ashley posted a lot of these links in the text chat earlier, so thank you. But we did want to provide some resources on self and community care, as well as some resources to mutual aid funds that are being organized, one of which is being organized by Amitha Swadheen, who presented on a past PreventConnect web conference, and they do a lot of great work in the child sexual abuse prevention area. And we want to leave you all with this parting question. Thinking of everything that we've talked about, what opportunities exist for sexual and intimate partner violence prevention right now? So if you have time and have a moment to type that in the text chat, we would love to hear more from you there. As you are typing, I wanted to share this quote from Monica, who said this in our SurveyMonkey. So Monica, thank you so much for sending this in. Right now, we are all aware of our impact on others, our community and world, but this is a power we always have against the hurtful behaviors, attitudes, and beliefs that make abuse and violence possible. I want folks to know that they always have power to create the world they want to live in. Thank you, Monica. I want to pass that along to everybody else, so I appreciate you passing that to us. And Ashley, I want to turn it back over to you in our last minute.
Thank you. Thanks so much to everyone who joined us today for the conversation. We will go ahead and create a document with links to the resources that were shared, so you have easy access to that. We'll also let you know when this recording has become available. I just wanted to leave you with our friends at the National Sexual Violence Resource Center have some great ideas for getting engaged online during this month of Sexual Assault Awareness Month. So go ahead, if you haven't already, and check that out. I'll link the blog to you where you can find that information. And then again, we kind of were super reactive to what's happening. We had to be. But this was just the first conversation. And so I do hope that you'll join us next week for a different conversation, but certainly there are lots of things that we talked about today that we will continue to discuss, I'm sure, on next week's web conference. So you are welcome to register and join us. And I just want to thank Alejandra, Sarah, thank you so much for presenting and sharing your insight during this time. Thanks everyone who joined for sharing your insight. Tori, thank you for keeping this technology going and sharing your insight. I'm just very grateful to everyone. So thank you. We hope to see you next week. I personally wish you all a wonderful rest of your week. Take care of yourselves, and we'll see you soon. Take care. Bye-bye.